many people, we are now instructed by our governments globally to adhere to the lockdown measures and remain indoors as a way to combat the coronavirus outbreak and mitigate the number of deaths, and also ensure that there is capacity for countries' health services, hospitals, social care centres and homes to contend with the patients of coronavirus and those who have contracted this new contagion. It's having a devastating effect upon a lot of sectors economically. However, I feel like many people have just complied with the instruction to remain indoors, and it's obviously devastating to hear of the death toll on a daily basis, especially in the UK. We have daily regular public news announcements press announcements by the ministers or Secretary of States, and it is escalating. We're hoping to reach the peak fairly shortly and to flatten what is defined as the sombrero curve of the coronavirus, but it's still a grim outlook for many, especially as the most vulnerable are now having to remain in, or have been recommended to remain in self-isolation or shielded for up to a period of 3 months because their immune systems are fairly fragile. And they are most at risk of fatality should they contract the coronavirus. So it is impacting everyone's lives to a profound extent, whether it's economically, socially. People are having to remain confined indoors. However, many people may not know someone directly who has been affected by coronavirus. It still seems as though it may be certain sectors of society, or we hear about the victims who've recovered, their personal reports of how lethal this virus is and the difficulties they have had to contend with the symptoms, talking about being very descriptive in the language used, and, these personal stories of victims of coronavirus who have since recovered just creates an awareness of how serious this it is, and no one wants to be lax and with regards to complying with the measures. And especially it's very tempting with the warm weather at the moment, and we're in the midst of spring, so it's highly tempting to wanting to go out and venture outdoors. But we know the reality is that we all have to collectively ensure that we comply and just do our best to remain preoccupied and create new activities to keep yourself engaged throughout the day. And whilst we are restricted to remain indoors for as long as is anticipated, at least for perhaps another 3 weeks whilst the government considers an extension of the lockdown in the UK, but that is already prevalent in many countries globally where lockdown has been enforced for quite a few weeks. One case recently of a very which had a significant impact, I think, upon a lot of people was the Prime Minister, Boris Johnson, who contracted the virus. It wasn't so much the case of, I feel personally, that, in my opinion, this is, that he actually contracted the virus. It was the fact that he deteriorated so rapidly from when we saw him, and I think it wasn't in the midst of anyone's mind that he would be fighting for his life a few days later. So that really graphic portrayal of how this coronavirus, kind of should not be assumed to be a contagion which can be easily fought by people who are in good health of a certain age. I think that is a falsehood, and with Prime Minister Boris Johnson contracting the virus and sent into, he was obviously instructed to self-isolate and remain indoors at his Downing Street flat back in late March on the 27th. And there were media pictures of him still running the country, using technologies and virtual remote communication software like Zoom to remain in touch with the cabinet team. And so he still seemed to be working flat out, and we have proof in the pictures which were available during his self-isolation period. And again, we saw photographs of media coverage of Boris Johnson standing outside 10 Downing Street and clapping, for the NHS and other key workers, which is now a regular weekly ritual in the UK at 8 PM on a Thursday, when people step outside and we all collectively cheer on them, and just a way to really demonstrate our support for these essential key workers and NHS heroes. We saw photos of or media coverage of Boris Johnson standing, a solitary figure standing outside number 10, clapping. However, he was soon after, I think that was on the Thursday, and on the Friday or soon after, he was admitted to a hospital in London with persistent symptoms only 3 days later on the Sunday evening. And as part of his treatment, was provided with oxygen on late Monday afternoon, and then was transferred late Monday evening to the intensive care unit of St Thomas's Hospital. So within that short period of time of just a few days, from seeing him outside, clapping for the NHS workers and other key workers, and then only 4 days later being admitted to intensive care after Boris Johnson's coronavirus symptoms worsened. And again, of course, upon the advice of his medical team, he was admitted into hospital. But this was an astonishing escalation in the decline of the health of the Prime Minister, and it's been well acknowledged that once coronavirus victims are admitted to intensive care, chances of survival are said to be 50-50, depending on how the patient responds to the treatment and whether or not symptoms are mitigated. And luckily, or fortunately, Boris Johnson has not recovered, but he has been since discharged and is now in a period of recovery and recuperation, which he obviously, having spent 3 days in intensive care, would not be expected to return to work. And it is a realization, I think, and a wake-up call for many people, especially in the UK, members of the public, to realize that we cannot have a blasé attitude or assumption that we may not be affected because we're not in in the vulnerable so-called list of group. And even if we don't know someone personally within our family or friends or work colleagues or a social network, just visually witnessing the decline of someone on social media within a few days, when you have the assumption that someone is perhaps recovering from the virus, and then a few days later the revelation that the individual is in actual fact now fighting for their life, really, to spell it out bluntly. And I mean, it's all credit to the National Health Service staff who treat all patients for COVID-19, and the immense amount of hard work and effort that is put in by all the teams which are involved in ensuring that patients get the best care possible once they are admitted into a hospital. So I think that it is a wake-up call for all of us that we need to all work collectively to ensure that we do our best to stay at home and adhere to the government measures which are regularly updated. And currently we are in lockdown, and with instructions upon when we should be going out only for essential shopping, and I think like one exercise per day is allowed, permissible locally, and it's really important and imperative that we do this so that we can actually come through on the other side successfully and as soon as possible, ensuring that we flatten the sombrero curve of the coronavirus and get back to normality as soon as we can, collectively as a society and as a nation, and ultimately ensure that we decrease the number of fatalities of this disease, virus, and those who reduce the number of those who may potentially contract it. Welcome to today's Comments podcast. As we all adjust to the new lockdown measures to combat the coronavirus outbreak, we'll be looking at Prime Minister Boris Johnson's personal battle to fight this new contagion, from his initial self-isolation to his admission to intensive care.